everyone, and welcome to Open. I'm Rhina Valentin, your host Café con Leche for the next hour, encouraging you to get social with us online as we continue during these social distancing times. Let's connect. Tweet us and follow us on Instagram at BronxNet TV or like us on Facebook at Open BronxNet Television. And you can always follow me on Twitter, FB, Instagram, Insta Stories, and LinkedIn at Rhina Valentin. In our new monthly segment brought to you by Essen Health Care, we will be providing knowledge related to health advocacy as we continue to deal with this pandemic. Let's get into our dose of essential medical information. In today's essential segment, we focus on HIV/AIDS awareness. HIV/AIDS continues to be an issue in the United States and around the world. According to the CDC, in 2018, an estimated 1.2 million people were living with HIV in the United States, and 14% of those people were unaware they even had it. Joining us to tell us more about the disease, please welcome Essen Health Care Primary and Urgent Care Medical Director, Dr. Silvio Goris. Hello, Doctor.
Hi, thank you for having me.
Thank you for being here. Welcome. Let's open up by establishing your role within Essen Health Care. I understand you recently became the medical director last year. And let's just talk about Essen Health Care's purpose within the borough and also the locations and how they're situated and where they're situated.
Of course. So Essen Health Care is really located throughout the Bronx. We have 28 offices between urgent care and our primary care. 15 urgent care sites and 13 offices. They're located all throughout the Bronx. The idea is that we can offer different care points to patients all through the Bronx to have access to primary care, their urgent care needs, also any specialty service that's required. The goal is really to be able to introduce better health habits to all of the population of the Bronx. And as an underserved area, we're aware that health education, health literacy, access to health are very big issues that we face here in the Bronx. So our goal is really to be able to remove some of those barriers by offering these services.
And so what location are you based out of?
So from urgent care, we have multiple locations, which, we do rotate through these locations throughout the whole Bronx. From primary care services, I do work at 2445 Arthur Avenue. That's going to be one of our locations based out in Little Italy in the Bronx. Very friendly environment. I love it there. It's very nice.
Well, thank you for sharing that. It's important to love what you do and love your environment as well. And so what are the most common reasons, let's say, or purposes that a person would visit Essen Health Care?
So we have multiple services that we offer. In our primary care side, we do continuity of care for different medical conditions, including high blood pressure, diabetes, cholesterol issues, patients coming for annual exams, and just routine checkups to make sure that, that everything is okay. Like you mentioned previously about the 14% of individuals with HIV that weren't even aware they had it. So we do believe that having access to routine care is very important. So we're very big on preventative care and offering services to patients to assure that all of their needs are met.
And so this past Tuesday was National HIV AIDS, actually it was World AIDS Day. And so with that awareness being brought to the world, what would you say would be a reason that one should consider being tested for HIV?
So, I mean, there's many reasons. One, just knowing that it's there, it's definitely a benefit because there's so much more resources now and so many more treatments now that people can actually go and be treated and go as undetected with adequate CD4 counts and really not have to worry with a lot of the complications that we used to see in the past with HIV. So given the advancements in medicine, it is very important to get tested early because now we can actually treat and be more effective in our treatments. Also, with the pandemic of COVID-19 and just the immunocompromised population that have higher risk for complications, it's definitely very important to understand what your risks are in these times.
And so I also know that you spearheaded the COVID-19 care program for Essen Health Care, which included pre-care, post-care, and monitoring of systems of thousands of patients in the Bronx. When it came, or when it comes to individuals with compromised immune systems, like how is that handled any differently?
Definitely, we definitely place a greater focus on patients that have any immunocompromised state. We want to make sure that we can give adequate follow through of care. A big portion of COVID-19 care was testing. So, then we were faced with the dilemma of, when we have these positive tests in patients with immunocompromised state, what do we do? How do we handle these patients? What's the best care that we can offer them in an outpatient setting to try to avoid any need of escalation of care, of ending up in hospitals, intubated in ICU. So we were able to team up with our group of specialists. We have infectious disease doctors, a pulmonologist, cardiologist, and as a group, we were able to come up with different systems to put in place to assure that they were getting adequate follow through, that they were being seen on time, that they were getting their medications on time, that we were identifying any possible barriers or complications that they might be facing, and that we were tackling them, in that given time period.
And so somebody has this compromised immune system and or is diagnosed with HIV, how often should they be getting tested? And in addition to how often should they be getting tested, what kind of symptoms should they be looking for? Do the symptoms for COVID apply? Are they differently affected, or rather, do they differently affect a person who has a compromised immune system? Is it, or should they be waiting? Excuse me, I'm trying to be very clear in my questioning. Should they be looking for the first sign as opposed to waiting in having symptoms?
So I would say we do know that a lot of the patients with COVID-19 have been asymptomatic. So it's a little bit hard to say what would be the first signs and symptoms. I would definitely say if they have any fevers, cough, shortness of breath, fatigue, any signs of any viral illness, it is important to be tested, just so we can give adequate follow-ups if COVID-19 is positive, or meaning if they do have the COVID-19. What I would say is, it is also beneficial for them to, maintain their social distancing protocols and really, not be in environments that might pose a higher risk, such as, different medical care centers, unless it's needed. I would say that the biggest issue that we would see or we would face is more of, their risk of complications due to COVID-19, not so much of their initial presentation or symptoms that they're seeing. So ideally, if they are positive, we want to definitely be able to give them close monitoring after identifying that positive test, because their risk of getting complications, whether that's respiratory compromise, whether that's hematological compromise, we've seen a lot of patients with DVTs and pulmonary embolisms, is going to be a lot higher than the regular population given their immune state.
So I also am aware that Essen Health Care offers telemedicine. So does an individual have to be present first before receiving that type of care, or can a person make an appointment, or do they need to do you accept walk-ins, and or do they need to have an initial file within Essen Healthcare, or could their hospital files be transferred to Essen Healthcare? What is that system?
We definitely accept walk-ins. We definitely want to open our program and services to everyone in the community. We don't really want to put more barriers or limitations. We understand that with COVID-19, a lot of medical centers have been closed, or just the access to care has been very limited. So we want to be able to offer as much access as possible, whether that's through telemedicine. It's as simple as going onto our website and booking an appointment with primary care team or specialty team, or calling our patient care center and getting an appointment booked. There's no need of having been previously seen or tested in one of our locations or having any files with us. If there's a need, we want to be able to meet that need and help as best we can.
Wonderful. Thank you so much. With us here today, Dr. Silvio Goris, and thank you for all your knowledge, and thank you for your service.
It's my pleasure. Thank you for having me, and have a wonderful day.
You too. Thank you. All right. Once again, you guys, for more on Essen Healthcare, you can visit essenhealthcare.com. We do have to take a quick break, but when we return, we'll hear about an annual toy drive for the holidays. Don't go anywhere.